Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video we are going to talk about HB or HGB test. Okay. Now this is again the video lecture that is related to the red blood cell count or RBC parameter. This is actually the RBC parameter, and in this test we mostly measure the amount of hemoglobin in the blood. HB or HGB means hemoglobin. So this is actually the hemoglobin test. Now what are the purpose of this test? The main purpose of this test to diagnose anemia and polycythemia. Anemia means low level of RBC. Polycythemia means high level of RBC. Then we have to check anemia treatment. Let's suppose if there is anemia in a patient, and let's suppose if we want to treat it, so we mostly give some medicine to treat the anemia problem. Now after that, what we have to do, we have to do that HB test again to just check whether the medicine are working or not. So through this test we can also check the effect of medicine on the anemia treatment. Then we have also used this test to diagnose different blood disorder like anemia, leukemia types of disorder. Now using this test we can also determine the genetic disorder or inherited blood disorder like thalassemia and hemophilia. Thalassemia is actually the blood disorder in which it is actually genetic disorder in which the body do not have the ability to produce enough hemoglobin. In case of the hemophilia, it is also the blood genetic disorder. Now hemophilia is again the genetic disorder in which the body do not have the ability to clot the blood. Then we have the normal range. So the normal range of the hemoglobin in case of the male is 16 to 18 mg per deciliter, and in case of the female the range is a little bit lower as compared to the male. It have 12 to 16 mg per deciliter. What's the reason behind it? Again, in case of the female there is the menstrual cycle. Due to this way the level of the hemoglobin is low. Then we have hemoglobin. Now to explain the test in more detail, first of all we have to know about the hemoglobin. Hemoglobin is actually, this is iron containing or pigment molecule of the RBC. Now the function of the hemoglobin is to transport respiratory gases, means it can transport the oxygen to all part of the body. There is hemoglobin which is present on the RBC. So on RBC, when the hemoglobin is present, what happens? They will carry the oxygen and they can also expel out the carbon dioxide from all part of the body through the lungs. Then the hemoglobin is actually contain hema, which is actually the iron portion, and globulin, that is the protein portion. Then there are two types of the hemoglobin we have, HbA and HbF. HbA means hemoglobin adult, hemoglobin fetal. Then we have synthesis of the hemoglobin. So mostly the hemoglobin are synthesized in the mitochondria, in which iron portion are synthesized, means hema portion, and it is also synthesized in the ribosome, in which protein portion are synthesized, means the globulin portion are synthesized. And it will be occur, the synthesis of the hemoglobin will be occur during the pro-erythroblastic stage, which is actually the RBC production stage. Then we have the destruction of the hemoglobin. So hemoglobin mostly destructed or split into two form, again into two form like globin and hema, when the RBC lifetime is over. Let's suppose the RBC lifetime is 120 days. So after 120 days the RBC are degraded by a cell which we call a reticuloendothelial cell. These are nothing but these are the monocytes that engulf the RBC when its time is over. So after that, once the RBC are engulfed, so what happened? It will be converted into hema and globin. Then we have the requirements, most important things that we required to find out the hemoglobin concentration in our body. We need blood sample, we need a Microlab 300 machine, or we can say spectrophotometer, distal water, hemoglobin meter, or Sahils meter. We need HCl, a hydrochloric N10 hydrochloric acid. We need hemoglobin tube, hemoglobin pipette, and we need automated hematology analyzer machine. So these things we need to find out the hemoglobin concentration. Then there are different methods. So each methods have different requirements, as we talked in the previous slide. We have different methods. These are not the total 5 methods. We have almost 10 methods, or almost 8 to 6 methods we have. Through these methods we can find out the hemoglobin, but the most important method through which we find out the hemoglobin is the Sahils method, using spectrophotometer and Microlab method, automated cell counter method, non-invasive method, blood gas analyzer. Among these 3 methods are really important to find out the hemoglobin concentration. Now first of all, let's explain the Sahils method, that how the Sahils method are used to find out the hemoglobin concentration in the blood. Sahils method, as the name indicate, it was actually the method that was proposed by a scientist named Sahils. So Sahils actually described a method through which they determine the hemoglobin. Okay, now this method is also called acid hematine method. Why? Because in this case HCl is used. Now what are the principle of this method? First of all, what happen, the blood is mixed with HCl. Now once it is mixed with HCl, so what happen, the hemoglobin means converted into brown color acid hematine. Once it is converted into hematine, what happen after that? It is further diluted until and unless its color is matched with the permanent stranded brown glass, which means this one. If the color, hemoglobin color is matched with this, so after that what we will do, we will estimate the hemoglobin concentration. Now let's talk the procedure, that how we can perform the hemoglobin estimation using this test. First of all, what we will do, first of all we have to take the blood in AGTA tube. Once the blood is taken in AGTA tube, then what we will do, we have to take clean and dry hemoglobin meter tube. Now this is hemoglobin meter tube or hemoglobin tube. Okay, now after that what we will do, after that we will fill it with N10 HCl up to 2 to 10 gram. Let's suppose once we take this hemoglobin tube, so then we have to fill it with 20. This is the 2 gram or 20. Okay, now after that what we will do, we have to take 20 microliter of the blood from the AGTA tube and will mix through the Sahils pipette and will mix it with N10 HCl in the hemoglobin tube. Now once we mix it, after that what we will do, we have to leave it at room temperature for 10 minutes. Due to this way, what happen, it will convert, the hemoglobin will convert it into hematine, means brownish color. After that what we will do, we have to add distilled water drop by drop and will mix it until and unless the color of the test, the color of the blood which we mix, it will be matched with the standard glass of the comparator. Means let's suppose here we will put our hemoglobin meter or hemoglobin tube having the blood as well as the solution. Once we mix it, after that what we have to compare the hemoglobin with this 2 solution, as you can see, and we will adding what, distilled water drop by drop until and unless if the color, let's suppose the blood color or let's suppose the solution color is matched with this. Let's suppose we adding the drop of the distilled water again and again, and let's suppose we are adding it again and again, and let's suppose we reach to this area. It means this is actually the area where the hemoglobin are present in the body. If it's, let's suppose if at that area the color is matched to this standard or this tube, so it means that hemoglobin level will be 40. If it is matched with if it is not matching, so we will adding again and again, and if at 80 portion if the color is matched, so then we will say that hemoglobin concentration will be this. So this is actually the percentage, okay? This is not the milligram per deciliter, okay? This is not, this is actually percentage. After that we will convert it into deciliter. Now this is actually how we can use this method to find out the hemoglobin concentration. What are the advantages of this Sahils method? The most important advantages is that we can easily perform this method because it do not need a high skill. Then this method do not require electricity, okay? And the reagents and the apertures which we used for this method, it is easily available at everywhere, and it's very cheap. And the reagents and the things, the apertures are less harmful to us. What are the disadvantages of the Sahils method? Let's talk about that. We have, this method give sometimes false result, and it required long time. Moreover, it cannot estimate all the hemoglobin level, like we have oxyhemoglobin, we have cyanohemoglobin, we have carboxyhemoglobin, carbomonohemoglobin, okay? So they only estimate oxyhemoglobin, not the other type of the hemoglobin. So these are the disadvantages. Now let's talk about the cynmethoglobin method. Again, in this case, what we used potassium cyanide and ferric cyanide. So once the blood is diluted with potassium and ferric cyanide, what happen? It will be converted into methemoglobin, and then it is further converted into cyanomethoglobin by the action of potassium cyanide. Now once the conversion each and everything is done, what we will do after that? After that, it should be determined using spectrophotometer or Microlab 3 machine. Using these two machines, then we will estimate the hemoglobin concentration. Let's talk the procedure that how we perform this one method. First of all, we have to take 20 microliter of the blood, and then we will mix it with 5 ml of the Darbin solution, and then we will leave it for 5 minutes to completely mix. After that, we put the mixture into civet of the spectrophotometer. This is civet, okay? It's mostly in a plastic or in a, what we can say, in a glass. Now after that, once we fill the civet with the mixture solution, then we will put it into the spectrophotometer and read the absorbance on the screen. But before that, we have to first read the blank solution, means the Darbin's reagents. Once we read it, so then we will neglect it. After that, we will put our test civet which contain our mixture, and after that we will read this one. Now this is actually the spectrophotometer machine, and this is the Microlab 300 machine solution. And after that, what happen? The color will be passes. So let's suppose this is the tube. So what happen? This machine is actually working on the light absorbance, okay? Now the light will be passes, and there are some lights that are absorbed in the solution. After that, some light will be passes. After that, when the some light is passes, what happen? There is the reading we will see on the screen. The same procedure we will also perform on this machine. Means in this, let's suppose first of all we open the lid, as you can see, and then at the first area, as you can see, at that first area, what we will do? At that first area we will put the standard, means the blank solution that contain Darbin, and at that area we will put our test civet that contain the mixture of Darbin and blood and each and everything. And after that we will cover it, means we will we close the lid. After closing the lid, what we will do? We have to check this using first of all we will check the blank, and we will neglect it and then put it 0, and then we have to adjust the wavelength. Wavelength will be 450 or 460. These are the different wavelength, but we mostly use 450 wavelength. After that, what we will do? After 450 wavelength, then we will check the reading. Now the reading, once we check it, so we noted. So this is how we can find out the spectrophotometer and Microlab 300. Now once we find out the absorbance, so what we will do? We have to find out the hemoglobin concentration. Now then we will calculate it using a formula. First of all, we have to put the value of absorbance test, means the keyword that contain our mixture. Then at the second we use absorbance of the standard, means the keyword that contain the Darwin solution. We have to put these values. Let's suppose the absorbance of the test value is 0.44 and the absorbance of the standard is 0.45. Then we have to multiply it with standard concentration, that will be 15. After that, what we get once we multiply, divide each and everything, then we get 14.66 GDL. That is the normal hemoglobin concentration. Now let's talk about the automated cell counter machine, or using this machine. So this is the hematology analyzer machine or automated cell counter machine. In this machine, what we will do, we have to put the bottle, which is actually a DTA bottle, a tube. They will suck the blood, means the needle will be dipped. After that, what happened, the blood is sucked. Now after that, what happened, this needle will be internalized into this machine, and after 5 minutes they will give you the hemoglobin concentration. Not only the hemoglobin concentration, but all the other parameter of the CBC as well, like WBC count, DLC, TLC, MCB, MCH, each and everything they will give you. Then we have another method which we called it non-invasive method by NBM 200. This is NBM 200 machine, and through this machine what we will do, the finger portion or any area of the portion will be not injured and the blood is not taken in this case. But in this case, what we will do, we just put our thumb finger, as we can see, into this machine. This is actually the finger area. Through this area we will put our thumb, as you can see, and after that we will start, we press the start button. After we press the start button, what they will do, they will estimate the hemoglobin through this, but it is actually not give you the correct result, but somehow you can a little bit satisfied that the hemoglobin concentration in the body, that is the hemoglobin concentration in the body. We not use mostly this method, but still it is used in the home or in the operation theater before operation. Okay, then we have another method which we call that gas analyzer method. This is actually blood gas. This is not the non-invasive, sorry, I mistakenly write it here, but this is actually the blood gas analyzer machine. Through this machine we can also find out the hemoglobin concentration. This is actually the syringe which can contain the blood. After that, what we will do, we will just give the syringe to this area, but remember guys, it will be not injected. They will just take the blood. After that, they use the gases, and after the gases uses in this by this machine, then they will give you the result of the hemoglobin in the blood. So these are all the method of the hemoglobin estimation. Now let's talk about the condition in which the hemoglobin concentration are high and the hemoglobin concentration are low. Let's talk first the causes of high hemoglobin, or when the hemoglobin concentration are high, what happen, or the condition at which the hemoglobin concentration are high. First we have the polycythemia vera. It means the high number of RBC in the body. So just think about it. When there is high number of RBC, what happen? Obviously the hemoglobin concentration is also increasing. Heart failure. As you better know that heart can pump the blood. So if the heart is failed, so what happened? The hemoglobin concentration are also increasing. Then we have liver and kidney cancer. Liver is specially responsible in metabolism process. Kidney contain adrenal gland that can produce erythropoietin. So due to the disorder, means the cancer in these two organs, obviously the hemoglobin concentration is increasing. Shock is another main disorder in which the hemoglobin concentration is also increasing. Renal cast, in which is actually in renal cast the hemoglobin concentration are also increase. In the case of dehydration, hemoglobin concentration are also increasing. It is due to the high number of the RBC. They do not have what plasma, or we can say liquid. Due to this way, hemoglobin, the RBC become concentrated. So due to this concentration, what happened, the hemoglobin level is increasing. Due to pulmonary diseases, means lungs disease, the hemoglobin concentration are also increasing. Why? Because if there is a disorder in the lungs, so let's suppose there will be high oxygen in the lungs, that can cause high hemoglobin concentration. Burn means if there is an area that can be burned, so due to this way hemoglobin concentration is also increasing at a higher altitude. So just think about that. If the people are living at a high area, means at the mountain area, at the hill area, so what happened, the oxygen concentration need to be increased at that area. So at that area the oxygen concentration need to be increased. That's why the hemoglobin concentration are high. Then there are some reason due to which the hemoglobin concentration are become low. So how we know that hemoglobin concentration are low in the body? When the blood are lost, due to this way the hemoglobin concentration are low. We have iron, vitamin, folic acid. These three things are necessary for the RBC production. If this is not present, so RBC will be not produced, due to which the hemoglobin concentration are become low. Kidney failure means adrenal gland are fill. If it is fail, so what happen? Now erythropoietin will be produced, that will not activate the bone marrow to produce the blood. If the blood cells are not produced, means RBC are not produced, hemoglobin level is automatically decreases. Bone marrow disorder means the bone marrow not producing enough level of the RBC, that will cause the low level of the hemoglobin. Leukemia, in which the white blood cell concentration are become high, due to which there is a low space for the RBC. So if there is low space for the RBC, so we have low hemoglobin. Chronic infection, in which again the RBC are WBC are increasing. If WBC is increasing, so what happen, hemoglobin is decreasing. Why? Because there is less space for the white blood cell, red blood cell. Then we have rheumatic fever, in which it is actually the inflammatory response, or in which the immune system are activated, and when the immune system are activated, so they will kill the bacterial or any type of the infection. Due to this way, what happened, there is a low number of the RBC production, so that can cause the low level of the hemoglobin. Then we have lymphoma, which is actually the lymphatic cancer, which can secrete the lymph node cancer, or that can secrete irregular WBC, high number of irregular WBC. In case of the pregnancy, it can also cause the low level of the hemoglobin. Why? Because in this case iron is deficient. Although the red blood cell are increased, but the iron is deficient. Due to this way, hemoglobin concentration are decreases. Due to the splenomegaly, in which the spleen are in a large size, so when the spleen are enlarged, so they will store a large number of the red blood cell. Due to this way, hemoglobin concentration are also decreases. Hemolytic disorder, in which the RBC are fastly rupture. Hemolytic disorder, in which the RBC are fastly rupture or destroyed. So when the RBC are fastly rupture or destroyed, so obviously hemoglobin concentration are also decreases. So these are all about the hemoglobin estimation and hemoglobin test. I hope you guys get idea about that. Thanks for watching.